Welcome back to TV5 News at 9. It is time now for Medical Moments with Covenant Healthcare. Joining us this morning is Tracy Bargeron. Thank you so much for calling in, Tracy. Appreciate you calling in.
Thank you for having me.
You are welcome. Okay, so today is called National Healthcare Decisions Day. Tell us more about that.
Well, National Healthcare Decisions Day is a day that is set aside to stress the importance of having good conversations with those close to us about future healthcare decisions. And since we never know when an event might occur, like a motor vehicle accident, where to any one of us at any time, it's important that we have these conversations early before a time comes when we need to make decisions. It really does apply to all adults.
Okay, now with everything going on in the world right now, who do you want people to feel empowered to do this?
Well, we really want everyone to feel empowered about this. It's a conversation that we have been encouraging people to take time to have, and not only have one conversation, but periodically review that conversation as your wishes are going to change over time. There is some uncertainty definitely in the world today, and people might be feeling stressed, a little bit worried about their own health or their health of their loved ones. So we want to make sure that people know there are resources available at Covenant to help through this time. One of those resources is assistance with having conversations about future healthcare decisions, and if desired, creating an advance directive, otherwise known as a durable power of attorney for healthcare.
Oh, please explain that, especially now during this time of uncertainty. What is an advance directive?
Okay, an advance directive is a document, it's a legal document that someone lists their healthcare wishes that can be honored, and if a time occurs when they cannot make decisions for themselves. There are actually two types of advance directives. One is known as a durable power of attorney for healthcare. The other is a living will. And there's some important differences that people in Michigan need to understand between the two. First of all, the durable power of attorney for healthcare is a document that has a place to designate a patient advocate, who is the person you would want most to speak for you if you could not. It also has some wishes regarding your healthcare preferences, where a living will is focused on your treatment preferences and usually does not include naming a patient advocate. So it's important to know that the state of Michigan legally recognizes a durable power of attorney for healthcare, but they do not legally recognize the living will.
Okay, so when someone's planning for a directive, an advance directive, do you recommend a family member, a friend, or just someone that they have confidence in?
It's a very good question. A lot of people automatically feel that this needs to be a family member. Sometimes the decisions that are going to be made might be too difficult for someone, the person that's closest to you, to make. So when you're thinking about who you want to designate, we encourage, number one, that you maybe select more than one person. For instance, if you were to pick your spouse, and like I said, this could be a motor vehicle accident where your spouse is most likely going to be with you and then couldn't speak for you as well. So we want to look for good qualities in a person that would make decisions for you. These qualities are, number one, that they're willing to accept the role and have some conversations with you. Number two, that they're willing to honor your wishes and share your wishes, even if they disagree with them. Because they have to understand that their role is just communicating what the wishes are you would have wanted, not the wishes they might want for you. It has to be somebody that can be able to make decisions during a crisis, able to have good conversations with the healthcare, and somebody that can be easily contacted. And that contact does not have to be in person. The contact can be over the phone if needed.
Now, what are some common misconceptions about advanced care planning?
There actually are a lot of misconceptions out there about advanced care planning. Do I have time to share more than one?
Yes, please. Some of the top ones that you...
So one of the first, I think, that I can talk about briefly is that there's a confusion between power of attorney document for finance versus a power of attorney document for healthcare. So if you have just a general power of attorney, this document is naming someone to help you make decisions with finances. Very different than a medical durable power of attorney, or as I said earlier, a durable power of attorney for healthcare, which is strictly allowing a person to make your healthcare decisions. So that's one common misconception. Another is that these documents belong at home in the safe. We really want people to bring these documents into their primary care physician as well as the hospital that they are most likely to be treated at, to make sure that the record is available if a crisis ever occurs and is needed. And I would have to say probably the biggest misconception is that people really feel that they don't need this. Maybe it's because they're young and healthy and they just don't feel they have the need for this, or they feel that their family members will know what they want when that time comes. What we do experience here in the hospital is that when this time comes, family members are stressed. They also have difficulty trying to make sure they're making a decision that the person would have wanted. So we say take time. If you feel those close to you really do know what your wishes would be, please take time to share in more detail with them. Think of this as a gift to them to maybe help them feel more confident if they ever need to make a decision for you, that their decisions are in line with what you have wanted.
Sure, and I'm sure there are a lot of questions that people still have. What resources are offered at Covenant to help support the community?
We actually have a lot of resources available through Covenant. We do offer one-on-one, in-person conversations to help facilitate this awkward conversation sometimes for people. We offer small group and large group presentations, and with our stay-at-home direction that we have currently, we are more than happy to create alternative ways to get the message out. We can have phone conferences, either one-on-one or with small groups, and we can also do Skype meetings. We do have a website that can be visited to share a little bit of the information we did today as well as other information. We do have brochures available that we're happy to mail to anyone so they can take their time maybe looking through and rereading the information. The brochures are on the Michigan Advanced Care Planning and Michigan Advanced Directives. There's a brochure on the role of a patient advocate. So if you've been asked to be a decision maker for somebody, it helps you prepare for when that time comes ahead of time. There's also a brochure on resuscitation and code status, which is a common question that patient advocates may be asked to make for someone else.
Sure.
We do offer as well for our providers, for nurses, social workers, chaplains, or anyone really helping people through these types of conversations and planning for future healthcare decisions. We have the Respecting Choices Advanced Care Planning Facilitator training that anyone is welcome to attend.
Wow, Tracy, just some great information and great answers and tips. Thank you so much for joining us. We really appreciate that.
Thank you.
You are welcome. Now, if you have any more information, you'd like any additional information, please head on over to the Hot Links page on WNEM.com.